Hello everyone, my name is Zach Hansen. I'm a physician assistant working alongside Dr. Kurtis Staples for Sonoran Orthopaedic Trauma Surgeons in Phoenix, Arizona. Today, we are taking you into the OR to show you the direct point of view process of performing an incision and drainage procedure for an infection. Before we get to the operating room, the primary indications for us to perform an IND are a fluctuant abscess and infections that have failed conservative treatment. Here we see numerous wounds on the body, showing the classic characteristics of redness, swelling, and skin breakdown. Now, let's jump into the OR and see this dramatic IND of a knee abscess.
Alright, incision. Oh, yeah. I don't think that was going to get better on its own.
Taking a knife, we've incised the skin. The pressure of the pus collection caused a mountain of infectious goo to come rushing out. With the abscess products now freed, we take wound swabs to send samples to the lab for analysis. This helps to guide the next steps of antibiotic management. Next, we wash the wound with sterile saline and debride the inner tissues to remove any further contaminants. An infection like this often forms loculations or small walled-off chambers inside the greater wound cavity. Using tools like curettes and rongeurs to debride the tissues helps to remove these loculations and more thoroughly clean the site. Once the washing and debridement is completed, we pack the wound with gauze that is impregnated with iodoform. Iodoform is an antiseptic agent commonly used in external wounds. This gauze is easily packed into the deep sockets of the wound and helps to reduce infection risks by cleaning the wound bed. After this procedure, a dedicated wound care team will continue with the management of this area. Over the course of weeks, they will, in serial fashion, remove this iodoform gauze and place new gauze into the wound. During this time, the wound continues to heal from secondary intention and the patient receives antibiotics for definitive care. Thank you for joining us on this point of view walkthrough of an incision and drainage procedure. Make sure to subscribe to the channel for more insights into the orthopedic trauma OR.